Hello everyone, welcome back to the Anatomy Lab. Today we are going to be taking a look at the cranial nerves, but in a slightly different way, where we're going to be looking at them as they go through these different places of the skull. Now, in a previous video, we saw how the cranial nerves come off of the brain. This is probably one of the clearest ways to find the cranial nerves. You'll see that they come off the brain and they extend off in a certain order. But as we'll see, like some of these nerves are also going to be going through certain foramina of the skull, and then also some of them will also be grouped together, which helps us to find them. So just to review really quickly, if you want to follow along, you have olfactory bulb, which is where olfactory CN1 will come off. And then next you'll have optic CN2, oculomotor CN3, the trochlear CN4 is coming off of the side over here, trigeminal CN5, abducens CN6, and then these two, facial CN7, vestibulocochlear CN8. Along the sides of the medulla oblongata, you have glossopharyngeal CN9, vagus CN10, accessory CN11, and then lastly, a little bit more anteriorly, hypoglossal CN12. Now with these in mind, you would also want to review your foramina of the skull, which is what we're going to be looking at to some extent today. So we talked about the foramina and how there are things that go through them, but just to review a little bit of what we have here. So here's the ethmoid bone with the olfactory foramina, those little tiny holes going through it. The two optic canals, the superior orbital fissure of the sphenoid bone, the foramen magnum of the sphenoid bone, the carotid canal of the temporal bone, internal acoustic meatus of temporal bone, and then between temporal and occipital bone, jugular foramen, the kind of like somewhat bean-shaped one right over here and here. And then you also have the hypoglossal hypoglossal canal, which is going to be going through here. And then lastly, foramen magnum, the big one. So with that in mind, let's go ahead and take a look at what we have here on this model. So basically what you're looking at here is kind of like a top-down view of the skull, which would be in this direction. So to get started, let's take a look at what we have here. And if you look closely, this right here is sitting right on top of this region of the skull. So frontal bone, ethmoid bone, ethmoid bone. And this is called the olfactory bulb with the olfactory tract connected to it, but the olfactory bulb sits right on top of here along the sides of the crista galli. But then those olfactory foramina will have nerves going through it, which are these small fibers here, which are olfactory CN1. So all of these going into the nasal cavity are extensions off of olfactory bulb. These are olfactory CN1. Now let's keep going. We had olfactory. What's next? So from olfactory, then we lead back to these two holes where you'll be able to see the optic canals, and the optic canals will be where a certain nerve goes through it, which is optic CN2. So optic CN2 is right back here, right along the front and lateral side of the sella turcica. Optic canal, optic CN2 that's going through it. And optic CN2 will go to the back of the eye, which is going to be supplying the retina's innervation for vision. Now to the side of the optic canal. So optic canal is right over here, but then right to the side of it, you can see that there's this fissure or crack. So it's a little not the best lighting, but you might be able to see that there's this little crack right here between the lesser and the greater wings of the sphenoid bone. This right here is called the superior orbital fissure. So maybe it's a little bit easier to see over here. Superior orbital fissure over here. And if you want to see it from the front, that actually might be the best. So right through here, this crack right here, that's superior orbital fissure. Now superior orbital fissure, that's actually going to have 4 cranial nerves in total, but one of them is a branch of one. But most of these, remember, are in the orbital region, which is still going to like the eye socket, meaning it's for the eye, but not for vision like optic CN2. These are going to be for eye movements. So they're going to like the muscles surrounding the eyes. So there's one that might come to mind in particular for muscle movements of the eye, which going down the list, you had OO, and then one more O. This is oculomotor CN3. So oculomotor CN3 is this next one. And then this is where it gets a little bit tricky, like looking at these, because there's a bunch of them grouped together. But look closely, and there's this skinny one right over here. And then this skinny one actually ends right here. So if you look closely, there's like this black edge right here, which is kind of indicating the end of this nerve. I mean, it's not the end of the nerve technically, but this right here is what's going to be trochlear CN4. So it's just cut off, but this is trochlear CN4, and this would be right over here. So oculomotor was the one in front, and then trochlear CN4 is kind of like behind it, and then slightly to the side as well. Now with this in mind, what's the next one, this big one? The big ones are trigeminal CN5. And furthermore, in the word trigeminal, you have those 3 branches, which is what tri means. And that would be ophthalmic 5-1, maxillary 5-2, and then mandibular 5-3. And furthermore, I guess if you want to see, well, you can see that the ophthalmic branch is going to be going through the superior orbital fissure as well, which is going to like the upper, or rather lower forehead region. And then furthermore, you have the foramen rotundum here, which is going to have the maxillary branch going through it. And then you have foramen ovale, which is going to have the mandibular branch going through it. Now, continuing on, there is the trigeminal nerve, which is right here, but after trigeminal, it kind of resets back to the midline, which is where you see abducens CN6. So abducens CN6, like, be careful because this ended right here. There's another nerve that's kind of hanging down. So I'm going to give you a little bit of a better view maybe. So this would be trochlear CN4, trigeminal CN5, and then this one that's hanging down is abducens CN6. So just make sure that you look at that carefully, because this model in particular does make that a little bit difficult, but you can still see them pretty clearly depending on like if you look at them carefully. Now, next, if you look closely, there is a hole over here. This right here is this one. So on the back of the petrous region, or the temporal mountain, which is what I like to call it, this right here is internal acoustic meatus. So this is internal acoustic meatus, and then if you recall, right after abducens, there are 2 nerves that are grouped together here. So that would be facial CN7 and vestibulocochlear CN8. And vestibulocochlear CN8, like going through the internal acoustic meatus, might make a little bit of sense, because cochlear, kind of like if you've known of cochlear implants, this is for hearing. So this nerve, vestibulocochlear CN8, is actually going to your inner ear inside of your temporal bone, which is going to help for hearing and balance. But a good way to find these nerves is by finding internal acoustic meatus, because these 2 will be grouped together going through the same hole. Now, in a similar manner, there's another hole down here, which you can kind of see, which is right over here. So let me turn it so it might be a little bit less confusing. So this right here was internal acoustic meatus with facial CN7, vestibulocochlear CN8. This one right here, a group of 3 nerves goes through this hole. This is jugular foramen. So jugular foramen, if you recall, was the bean-shaped one, which was one of the bigger holes. So this one down here was jugular foramen, and that's going to be this hole, which is somewhat large enough to have 3 nerves going through it. And then furthermore, going back to the brain, do you remember? There were 3 nerves grouped together. It's the same thing. So if you can group them, that's very helpful for you to find them. So to keep continuing from where we stopped though, what number was this? This was vestibulocochlear CN number 8. So these 3 are going to be 9, 10, and then 11. So next we have glossopharyngeal CN9, vagus CN10, and then accessory CN11. So accessory CN11 is going to be your last one, which kind of like hangs down and then goes along like the neck as well. But then over here you have one more hole and one more nerve, and luckily these are sharing the same kind of like naming. This is hypoglossal canal, and then you also have hypoglossal CN12 going through it. So once again, hypoglossal CN12 goes through hypoglossal canal, which makes sense because this is a little bit anterior to the foramen magnum, being at like the 10 and 2 o'clock positions. And furthermore, on the brain, if you recall, hypoglossal CN12 was a little bit more anterior to your other group of 3 back here. So you have to go a little bit anteriorly to find hypoglossal CN12 in the front. So you can see that that's going to be going through here, coming off of the brainstem, and then this right here is your foramen magnum with your medulla oblongata, and then also your vertebral artery. So this model does cause some trouble sometimes. I mean, you kind of have to look at it a little bit carefully, but based off of the holes that they go through and then the groupings of the nerves, like it's actually pretty helpful, in fact. So if you can, do your best to try and find the nerves on here and then relate them to the brain, and then also relate them to the skull, because the more you can connect things, I mean, the better it will be for you to be able to remember them. If you can remember one, you'll usually be able to remember the others. But with that said, that's about it for this video. So good luck with your studying. Thank you for listening, and I'll see you all next time.